Thank you for tuning in to Ending the Arkansas Opidemic, the vodcast that takes a deep dive into the opioid epidemic in Arkansas. Here we will talk about life-changing impact that opioids are having on Arkansans and speak to the other people who have seen the devastating effects of opioid misuse firsthand. My name is Kirk Lane, and I am the Arkansas Drug Director. And today I have joining me is Dr. Cheryl May, the Director of the Arkansas Criminal Justice Institute. My hope is that this program can bring awareness to the opioid epidemic in Arkansas and help us all work together to prevent opioid misuse and abuse and save lives of countless Arkansans. So, welcome, Dr. May. I know it's a hot day and we have a lot to talk about, so we'll just kind of dive into it. So, who is Cheryl May?
Oh boy, that's a tough question. She's a wild and crazy gal that really loves what she gets to do. I'm a mom. I'm director of the Criminal Justice Institute, and I'm extremely passionate about issues relating to kids.
So, kind of a preliminary before we go into drug-endangered children. So, what is the Criminal Justice Institute and what do they do?
The Criminal Justice Institute is one of the 20 individual institutions of higher ed under the University of Arkansas system umbrella. We primarily focus our mission, our vision is to make communities safer one officer at a time. And the way in which we do that is by providing advanced and specialized training, collaborative partnerships, educational opportunities. Our purpose is to be able to help make law enforcement the best they can be in the state of Arkansas.
That's great. So, getting into drug-endangered children, what would be your definition of a drug-endangered child?
Technically, drug-endangered children are kids who live in homes where there are illicit drug activities, and that can vary. It could be their caregiver, it could be their parent, their guardian, it could be any particular type of drug. And we primarily, this term, drug-endangered children, or DEC, as we call it, because we all have acronyms, originated back in the mid-90s. And it was primarily coined by an incredible lady by the name of Susan Weber Brown. And she was an investigator for a DA's office in California. And basically, Sue realized, very astutely so, that primarily wrapped around all the meth labs that there were, that these kids living in these labs were at risk of a variety of environmental hazards, but also they were being maltreated. And so there was a community, a national community, that grew around this whole concept. And at first, it was all focused on meth labs. And then, as you know, many states did like what we did here in Arkansas, passed some very, very critical laws, like putting pseudoephedrine behind the counter, because that was one of the primary ingredients to meth labs. And I mean, if you think back in 2004, we were doing 1,200, 1,300 labs in our state. And I can remember getting phone calls from folks going, okay, hey, we've got a kid in these labs. What are we supposed to do? So we started looking around for, there had to be somebody else. And so there was this national group. And they brought a big program to Arkansas. Even the Attorney General back then, Mike Beebe, was the one that helped kick all of this off. And from there, we realized that it wasn't just meth labs. It was any kind of meth that was being abused because of the nature of tweakers and the violence associated with those types of drug environments, or really any drug environment. There's a tremendous amount of violence, that these kids are at risk of physical and sexual abuse and mostly neglect. So once we saw the number of meth labs go down, there were a bunch of folks that said, well, okay, we don't have a problem anymore. but unfortunately, we do because it's just not kids living in meth, where meth is being illicit meth is being used, distributed, or even made. But it's also when you have other drugs like cocaine, alcohol, marijuana, we can't leave out by any stretch of the imagination. And then finally, last and definitely not least, is misuse of opioids.
Great. So, what, as you saw the meth lab issue evolved, and we're talking probably late 70s, 80s, early 90s, as we moved into the opioid epidemic, did you see some trend changes in there as far as the type of danger that children are involved with? Or what seemed to be factors that you were seeing that really tied it to the opioid epidemic?
When you look at some of the other drugs, I think we've got to look at how it manifested itself and manifests itself. It still does today. Is that if you're a kid and live in a home and one of your parents is tweaking, they take simple discipline and it can get out of hand. Lose track of where your kid is, and so that child might not be sexually assaulted by you, but you might leave them with a predator and they would get sexually assaulted. What we've seen is that with opioids, like some of the other drugs, including methamphetamine, the biggest number of these kids fall in the neglect category. And so, they're at risk of environmental issues. You can find them wandering on the streets. And what we've learned through what we've done at CJI is that there's a group of professionals that can help identify who these kids are. And they are all passionate about children, but yet at the same time, when we first started this initiative in Arkansas, they were very siloed. Our program, it's focused on trying to get law enforcement, child welfare, community correction, and our schools all aligned in a way that we can identify who these kids are. Because one of the big issues that hadn't been addressed before is the fact that while we know the kids are impacted and there's a tremendous amount of recidivism, whether it's in law enforcement or through the child welfare system, the root issue is not being addressed. The symptom is the child abuse, but the root issue is that illicit drug use. And as based on the work that we've done together on opioids, and particularly the data that you have, is that when you look at those folks that are overdosing, they're 20 to 50, 60 years old. And when you look at who those individuals are, those are not kids themselves, although we've seen a rise in at least overdose deaths within teenagers. But these are their parents that are dying. And when they live in these homes, they are extremely traumatic. And whether we like to think about this or not, these kids grow up thinking that these homes are normal and that this is a normal life and that they love their parents. And it would be tremendously traumatic to pull those kids out of those homes, let alone for them to lose a parent because of an overdose.
Yeah, I would agree with that. I think also they see their parents and a lot of times turning to substance use to solve problems, and that is the wave of the future for them when they get into those tough
Correct.
situations to mimic what their parents.
Correct. I mean, we say when we look at our overall program, our primary goal is to break this cycle because you, with your experience, as a law enforcement professional, and then also with your work of as drug director, you see that there's a certain amount of generational issues, and we've had individuals that we've known both know that they grew up as a drug-endangered child, and then they became. Or they developed a substance use disorder.
Right. So, tough question for you. How many drug-endangered children do we have?
I can't answer that question for you. That's how tough it is. It's a very, very complex question. It might
Mm,
seem very simple on the outside, but we don't keep track of the number of our kids that are in our systems that would fall into this category. Um, Most of those data are collected by Children and Family Services through their CRIS system, but yet social service workers are not trained to identify drugs. Sometimes they will have to get a urine analysis, and then they know that, but they're not trained. There was one estimate, the latest estimate that I saw, I guess, was back in 2019, where 1 in 8 kids in this country live in a home where there's a caregiver that has a substance use disorder. And then specific to opioids, the United Fund study came out, I think in 2019, and basically said that there are 2 million kids that are being impacted across this country because of just the issue of opioids. And they were able to estimate that 22,000 of those kids are in Arkansas. But what I always emphasize is that that's just opioids. And as you and I both know, as much of a major issue that opioids are for our state, meth is still the number one drug threat that we have. So when you look at the number of kids, it's a severe underestimate.
So I want to kind of explore that a little bit because as we realize the number or the reality of the number of drug-endangered children that we have, what is ACEs? Can you explain?
Adverse childhood experiences,
Mhm.
those are significant events that we've all experienced that can have very profound effects on what we become as an adult and even our health level
Right.
and our health experience as an adult. And the more and more of those ACE characteristics or events that you have, the less likely the individual is to be healthy, or the more likely they're to have less health.
Yeah, so I know we evaluate ACEs scores or ACEs events in there. Drug-endangered children would be a significant event within the ACEs.
Yeah, and there could be a number of events that
Right.
occur that would be characterized as an adverse childhood event that these drug endangered children have.
So CJI and with your leadership developed a maltreatment and drug-endangered children initiative.
Mhm.
Tell us about that and how did that develop?
Well, it was quite a journey. I mentioned a little earlier that when we first started going, wow, these kids in labs, what are we going to do?
Right.
That basically, I contacted this national organization, and they brought their dog and pony show here to Arkansas. And it, talked about it being multidisciplinary, where you had, an instructor that talked about law enforcement, one that was geared towards prosecution, one that was geared towards social service, one that was geared toward medical. And it was all done in a very, very siloed approach. And I walked out of that presentation going, this is nothing but awareness. And, like awareness, it's like standing out in the middle of a field with a big flag and waving that flag. It makes us aware of the problem, but it doesn't give us any solutions to how to address
Right.
this problem. And so we began a journey, and I've got to talk about Sergeant Jim Gerhardt with the Thornton, Colorado Police Department. Him and Dr. Nikki Erb, the three of us formed a team. And so we started doing awareness programs around the state for law enforcement and children and family services staff. And in the process, we learned a tremendous amount that despite the fact that these are two groups that care enormously and are very passionate about kids, they don't get along really well. There's misconceptions on both sides. So we spent quite a bit of time trying to get roles and responsibilities done. And we literally covered the entire state, and we talked about the importance of what we call early identification. And the reason why we wanted to focus on early identification was because the sooner you can get the child and that family identified, the hope was always to be able to get services to them so that we can help break that cycle and get to that root cause. You know, a lot of folks talk about the parents needing, treatment. And yes, I completely agree. But one thing that there hasn't been a lot of discussion about is that these kids needing the therapy and treatment, because if they don't get that, then that whole cycle is not going to break. And at one point, we had the epiphany and we were like, wow, all we're doing is awareness. So we took the next step, which I like to call operationalized training. And it's not just training, making you aware, giving you knowledge. We wanted to roll up our sleeves and to actually help these counties in their implementation of this program. And we devised a program. It's now called an accreditation program, but it's within 4 disciplines. It's law enforcement, children and family services, community correction, and schools. And the biggest piece of that is how they can collaborate with each other, and how critically important it is that each and every one of those disciplines and those professions, they have to communicate with each other so that we can identify these kids and their families on that path. Because as one of the things that is the goal of the Division of Children and Family Services is to unite kids and their families. It's the reunification. And so we could never do anything that would be contrary to that unless it was unequivocally, absolutely necessary. And in some cases, it is.
Right.
Some cases, the safety in those homes are so bad, even DCFS would say that. But what it turned out is that each of these disciplines had their own perception of each other, and it was breaking down their ability to collaborate. So through this, what I like to call initiative, that we're able to break down those barriers, get them to communicate a lot earlier and a lot better. There's cross training between children and family services. One of the big complaints we used to hear, and we still do hear to some extent, is the fact that law enforcement, they mandated reporter, of course, they phone the hotline and then nothing happens and it's rejected.
Right.
Well, DCFS can help law enforcement identify the best way in which to describe certain circumstances so that it could trigger. Children and Family Services, I don't know if it's a cultural phenomenon, but they typically don't like law enforcement there at the scene. They feel that it's a barrier to the family, even though child welfare can also be a barrier to that family. But what we've been able to help these communities and these professions understand that there's a lot going on that law enforcement knows that DCFS doesn't know that can impact the safety of that kid as well as that social service worker. And so by better communicating and knowing if there's any history involved in that family can be critically important. And then there's going to be certain things that, children and family service folks can see at the scene that law enforcement can't, and vice versa. Law enforcement is trained in a slightly different way.
Right.
And so if we're going to really identify whether there are, drugs involved, then we've got to have that particular participation. And then community correction. A lot of folks are in prison right now because of drugs, and many of them have children. And when they're put on probation and parole, they may get to see their kids, there may be issues. Right. And so getting community correction and DCFS on the same page. And then there's our schools. And our schools are, they are our number one mandated reporters as far as submitting reports. But yet there can be traumatic events that happen to a kid. That kid could go to school the next day and nobody know. So the kid could act out, not have their homework done, fall asleep, and basically get in even more trouble and escalate the disciplinary process. So we've developed a part of our program that's mirrored out of West Virginia. That's called Handle with Care in West Virginia, but we can't call that here in Arkansas because Handle with Care is another program that deals with restraining kids, and we don't want to get the two confused because there's a very, very big difference. So a couple of our counties got together and they came up with the name Paycheck. And so what Paycheck is that if there's if their parents are arrested, if there's a traumatic incident that happens in that home, then there's either law enforcement or children and family services that can send a note to the school that basically says, hey, this kid's been traumatized. Treat them gently. Don't have to talk about what the circumstances were. If they act out, they may need some services. Right. The last thing that we want to do is try to re-traumatize those kids by people asking them questions. And they don't need to be more traumatized than what they have already. We also request that they, in order to participate in this program, that they've got to adopt the law enforcement agencies have to adopt IACPs protecting children of arrested parents. And they're given training about how to interact with the kids and interact with the parents in front of the kids, because that can create tremendous trauma for the kids. And children and family service workers also get trauma-informed response training. So we've tried to loop this all together in such an integrated way that a kid can be identified at any spectrum. And if we only focused on the drug issue, we would miss a lot of the kids. I think that's a really important point to understand, that by us casting our net at maltreatment, any kids that are maltreated, we can save kids, but also be able to identify those that live in homes where there's illicit drug use.
I know you have created a number of pilot and sustaining programs in the state. Do you know roughly how many you've created, how many jurisdictions?
I think we're in 7 counties.
7 counties.
7
And
counties
so
right now.
I know you have seen the pluses and minuses of some of those
Yeah.
programs. So what would you say are some of the pluses that you see?
Well, I think number one, when folks realize that this is going to absolutely help them do their job better and help them protect each other, and in doing so, also protect and identify these kids, it's an enormous plus for everybody. The other thing to understand too, anytime you try to ask people in groups of professions to collaborate, it spills over into other things. So we're seeing them develop collaborations on other issues. They get to know each other better. They can feel comfortable of picking up the phone and cell phone and calling either the law enforcement supervisor or the children and family services or the community correction or the superintendent and have a conversation with them even before they do a lot of the paperwork and to discuss what's going on. And I think ultimately that ends up being a really, really big plus. And hopefully, one big piece of what we're trying to do is the data collection part. Because as you know, based on what we've tried to do with the opioids and the overdose, being able to look at those data and to being able to look at certain findings and patterns, we can make better policy and more informed policy decisions. And so part of the program that we've implemented is that they must submit forms each time that there's a that there's a case where law enforcement and children and family services or DCFS and community correction, anytime they do that, they've got to submit a form. We've created a portal that's on our website that they can go in, click it all. We also have created a portal where they can go in and do their paycheck form, and it gets sent to the right person at the school. And then we can see a running tally of what not only how many, but where are these incidents occurring.
Right.
So it's very data driven.
That's great. So I know you talked about the pluses. What minuses or what doesn't work in some of the pilots that you have that needs improvement?
Two of our principal professions are law enforcement and children and family services. Okay. And this is an extraordinary time for both these groups. And unfortunately, after going through COVID, it's created a variety of staffing issues for them. And sometimes things like this can be perceived, at least in the short term, as taking more time and more effort, but in the long run, it doesn't. So sometimes you might have individuals that, well, I don't need to do this, or, I'm sorry, I just don't have time to do that. Or, a law enforcement agency that might say, I'm sorry, but we're understaffed. We can't do this program, even though they're within one of the counties. These kids are going to be there regardless of whether they have time for them or not.
Sure.
And it's really important that they be able to do this in the right way. And you know me, I'm very biased, but I think this is the most effective way to do this. I also know on the data collection piece, and I know with your project as well, if you ask them to do something that's a little bit over, it can be very, very challenging for them because of the staffing issues with COVID and with all of the groups, even our schools.
So, what other challenges outside of collaboration needs and having a heart for the issue that you see with those partners you trained? Is there any other issues that you see as far as a state perspective or a community buy-in perspective of what you're implementing?
Yeah, we just can't go into a county and we can't say, well, we're going to do this program here. I've got to do a tremendous amount of outreach within that county, law enforcement and children and family services, as well as the schools, and see if there's an interest in participating. Sometimes, that can be an enormous challenge. But one of our biggest challenges is, of course, funding. Not being able to have funding, and we're starting to get more instructors now that can help us, and we've got a staff person at CJI now that can help coordinate all of this, but being able to get out into more counties. So one of the things that I'm going to do, and I said I was never going to do this, is that the paycheck program, because I think it's so important that our schools become aware of when a kid is traumatized like that, that we're going to roll this program out statewide, even though they're not part of the maltreatment and drug
Right.
endangered children program, only because I think it's extremely warranted. I think it can have a tremendous impact on how a child is treated at school, and the potential for access to potential services, and the impact that can have.
So, moving forward, how many states have a program like this?
There are states that have what they call a drug endangered children program, but it's not the operationalized training that we do. We've taken it one step further than anybody else in the country does. There are the National Alliance for Drug Endangered Children. They provide training, and it's that awareness training, and they provide toolkits and that provides, little gadgets that, these communities can do. But nobody's put together all these individual pieces along with the critical piece of data collection so that we can see what the outcomes are than Arkansas.
So, Doc, where are we going from here? What new and innovative ideas do you have to make this even better? Would you say that you would like to see achieved?
Well, I'd like to see us get in more counties because I think the more counties that we can get in, uh, number one, the more kids are going to get protected and get the services that they need. But this collaboration between law enforcement and children and family services, I think, is a golden lining that can spill over into so many different things. Juvenile justice reform, because our ultimate goal is to keep as many kids safe. And if they grow up in these environments and they get in discipline issues at school, that's going to accelerate them getting in the juvenile justice system. And we don't want to see that happen. So the more that we can get out there and can actually get trained to do these programs, and we can work with them to do them right and to be able to get the data back that can show us that they are, in fact, we're profoundly changing the way law enforcement and children and family services work together. And I think that can have major, very, very positive issues going forward.
So this is a program, from my perspective, that I don't see you farming out much, especially on coming in and doing those pilots. You roll up your sleeves and you're right in there teaching that program. Why is that?
Why do I take such a personal interest in it? Because our kids are our future. I grew up in a very, very small rural community, and I've just always loved kids. And there's something about me that's drawn to kids. But I also know that there were those of us that were kids back then that are adults making a difference now. And so we've got to do everything that we can to give our kids the best start and the best foundation that we can. And if they're living in these kind of homes, that's not going to be good for them, and it's not going to be good for us.
Well, Doc, what else would you want to add to what we've talked about today?
I'm excited about what we're able to do, and I'm very hopeful that we're going to be able to expand into more counties. And you know me, I want every county in Arkansas.
In my opinion, Arkansas, we're really blessed to have your leadership and your
Thank you.
and your passion and your heart for what you're doing, not only for the kids, which I know you always say you're standing for kids, but for the families around them in those communities in the future. So thank you for your partnership.
You're very welcome. I can't thank you enough for the partnership that we have too. I think we've been able to do a lot of really, really good things, and you're an incredible leader, and I'm very
got more to
glad
do.
we got a lot more to
We
do.
got a lot more to do.
Yes, sir.
Thank you very much.
Thank you.
Thank you for tuning in to today's vodcast. For more information about Arkansas's Maltreatment and Drug-Endangered Children's Program, visit cji.edu. Additionally, find more free resources by downloading the Arkansas app.